歡迎大家嚟到今日嘅簡報會。台上面兩位。
Welcome to the press briefing. We have Dr. Albert Au, Principal Medical and Health Officer from the Center for Health Protection, and Dr. Sarah Ho, Chief Manager of the Hospital Authority. Dr. Au will first give you an update on cases. Friends of the media, members of the public, good afternoon. I would like to report the number of cases as reported on the 9th of March yesterday. On the 9th of March, there are 24,390 PCR positive cases. Case number 5412402575629. Among the 24,390 PCR positive cases, 2,706 confirmed by the hospital authority, 2,352 confirmed by the public health laboratory, and the remaining 19,322 cases are confirmed by private laboratories. 10 are imported cases, and for the remaining 24,380 cases are local infection cases. Yesterday, the public health laboratory services conducted genetic analysis on 2,552 specimens, and no L452R positive specimens were found. The last day when we found a positive L45R cases was on the 2nd of March. That means we have not found any Delta cases for a few days now. And then 778 cases tested negative to L45R2. That means they are Omicron strains. And for the remaining 1,500 cases, either we're still waiting for the result, or there's not enough viral load for definitive test. As for rapid antigen test results, 7,012 cases were reported on the platform on the 9th of March. So on the 9th of March in total in Hong Kong, we have additional 31,402 confirmed cases. That includes 24,390 PCR positive cases and 7,012 RAT positive cases. In the fifth wave of the epidemic in total, there are 604,788 positive cases. And from the cases that were reported last week, we find that Kwun Tong has the highest number of cases from the addresses reported. That accounts for 12.8% of all the cases. And second on the list is Yuen Long. It accounts for 9.6% of all cases. And third on the list is the Sha Tin, that accounts for 9% of all the total cases. So in the past week, these three districts have seen the most infection cases. But of course, there are cases in other districts as well. On residential care homes, there are 23 more residential care homes with infection cases or outbreaks. That is 12 residential care homes for the elderly and 11 for the disabled. In total, 190 cases, 144 are residents and 46 are staff members. And so far for RCH, 722 homes have seen cases. And last week, there are additional 437 homes with cases. They account for 50% of all the homes in Hong Kong. For outbreaks, for cases in RCHEs, that's 22,070 residents. That's 9.4% of all cases, and then there are also involved 5,886 staff members, or 19.7%. And then for residential care homes for the disabled, there are 248 homes involved with cases. In the past 2 weeks, the 883 homes have seen infections. That's 54% of all such homes. So that involved in total 5,900 residents. That's 32.5% 3% of all residents. And also, there are 2,220 staff members infected, accounting for 21% of staff members for all RCHDs. And then there are 1,728 fatalities involving home residents. Most of them were elderly home residents. As for the latest death case figure, in the fifth wave, we have recorded 2,937 death cases, an increase of 281 cases compared to the day before. The fatality rate is 0.49%. The age is 11 months to 112 years old. The median age remains 85 years old. And there are 5 cases involving children. As for adults, 136 cases, which accounts for 0.63% of the total. As for elderly, death cases, for those aged 60 or above, 2,791 cases, or 95% of the total cases, death cases. And then 2,031 death cases involved elderly aged 80 or above, which is 69% of all the death cases. So from the latest analysis of the CHP, we can see that among the death cases, 90.7% have not had vaccination, not have had only just one dose of vaccine. And for those aged 80 or above who passed away, 92.6% of them did not get vaccination or had only one dose. Now we can look at the difference in the fatality rate for those who've had different doses of vaccine. For those who've had 2 doses of vaccine, for those who've not been vaccinated or had just 1 dose, the fatality rate is 1.75%, and that compares to 0.07% of those who've had 2 doses of vaccine, so it's a 25 times difference. For an elderly person aged 80 or above, if the person has not had any doses or just 1 dose, then the fatality rate is 11.39%. And for those who've had 2 doses, the fatality rate is just 2.42%, so a difference of 5 times. Thank you. Dr. Sarah Ho. Good afternoon. There are 9,350 confirmed patients and presumed positive cases in public hospitals, North Lantau Hospital, Hong Kong Infection Control Center, Hospital Authority Infectious Disease Center, and the AW Community Treatment Facility. Yesterday, there were 75 cases in critical condition, 130 in serious condition, 71 patients are in the ICUs. As at midnight last night, in the past 24 hours, there are 180 patients who passed away and who tested positive for COVID. 123 of them were males, 57 were females. The age range was between 47 and 112. And then 94 of those who passed away came from homes. 122 did not have record of vaccination. 36 had 1 dose of vaccine. 22 had 2 doses of vaccine. 167 of the deceased were age 65 or above. And few who passed away were of a relatively younger age. I would like to give you some information about them. The first case, a 47-year-old female, well, she had tumors which had spread, the cancer that had spread. And the second case, a 48-year-old male, he didn't have any underlying conditions. On the 6th of March, he did a rapid antigen test, and the result was positive. On the 8th of March, he went to the accident and emergency department. He had pain in the abdomen, and he found that he had some sort of inflammation in his tendon, and then he also had sepsis, and then he passed away, unfortunately. There were a few more patients, one a 49-year-old male, 54-year-old male, 57-year-old female, 59-year-old female. For all these 4 patients, they had underlying conditions. say some needed renal dialysis, and then others had other chronic condition. And then there was a backlog of some data. We have to report them today. Between the 28th of February to the 8th of March, 101 patients passed away, and there was no announcement on that. 57 males and 47 females, aged between 52 and 103. In the past day, 879 patients recovered and were discharged. And about 40 patients tested positive upon admission screening. There are 70-odd patients in the same ward who will be listed as close contacts. As for staff members, so far there are 12,554 staff members who are confirmed cases. 4,455 are back at work. For the Tonghua Group of Hospital, Fung Yue King Hospital, it will become a designated COVID hospital from tomorrow. The hospital has a total of 260 beds, and all these beds will be used for treating COVID patients. This measure will help us to concentrate our resources and manpower to take care of patients in the face of the severe epidemic. Now, for patients originally in the hospital, they have been transferred to the Duchess of Kent convalescent hospital in Tai Hwan and another hospital, and then the day service of the hospital would be suspended. Patients will be informed. For the Fung Yue King Hospital, the routes for patients to go in and out of the hospital, they have enhanced their ventilation facilities. They're also providing staff members with suitable personal protective equipment, and staff are given infection control training. And so there is a sufficient supply of PPEs, and hospitals will do their best to ensure the health of patients and staff members. And then they will work with other, also the hospital authority work with other clusters to enhance the service for different clusters. Now for the Queen Elizabeth Hospital, it will be turned into a designated hospital, and you would have read from the news that in the past 2 days, the hospital has been busy trying to transfer non-COVID patients to other hospitals. So here we would like to make an appeal to the public. Please try to support our work. If you don't have a critical condition, please do not go to the Accident and Emergency Department of the Queen Elizabeth Hospital. Please avoid adding to the burden of our colleagues, disrupting our transfer of patients. For confirmed patients with mild symptoms, you could go to designated clinics and make an appointment. Please work with us. On the transfer of patients from the Queen Elizabeth Hospital is still ongoing. In the past day, for patients who to be discharged or transferred, we've dealt with about a quarter of them. For the remaining patients, we will transfer them to other hospitals or discharge them. The hospital has also selected 60 patients that in good suitable condition to be transferred to private hospitals. Private hospitals have confirmed that they would take up 20 of these patients. And then we talk to other private hospitals, so they will take up the other 40 patients who are suitable for transfer to private hospitals. Well, I would like to thank colleagues again and different hospital clusters for their support, because it's with their help that we are able to transfer patients to other patients without take-up. And we are also grateful to different sectors and the community for their understanding. Thank you.
We will now take questions. Please identify your media organization before you ask your questions. The lady in the front. Hi, I'm from Now TV. Now about the figures. Today, the number reported from the RAT is obviously lower than yesterday. And today, the total tally is some 30,000 cases. So according to the CHP's assessment, have we already reached the peak? Previously, we had some 50,000 cases per day. Now it has climbed down to 30,000. So is that a downward trend? My question for HA about the deceased patients with no underlying disease. You said he had sepsis. Is that caused by the COVID virus? Can you give us more details on that? And also, yesterday, there was a staff meeting at the hospital. Some staff members were in tears. They said they had a very hard time. So what is the morale of medical staff? Now about the latest trend. If you look at the past 1 or 2 weeks figures, we saw the peak between the 2nd and 4th of March. At the time, for PCR positive cases, we had over 50,000 each day. And then on the 5th and 6th, the number of positive PCR tests climbed down to some 30,000. In the past 4 days, the number ranged between 25,000 and 30,000 positive PCR tests. Judging by the trend, it seems that we have already peaked. We don't have higher figures, and also the number has climbed down. In addition, we have the figures from RAT to help us judge the actual situation. Now, since the 6th of March, when we began accepting RAT results, every day we had some 10,000 RAT positive cases. It seems that the number remained stable. Yesterday, the number even climbed down. So we are optimistic about the situation. We may see smaller numbers each day, but please do not let your guard down. Over the past 2 months, we have been adhering to stringent measures, coupled with active testing. We have identified patients, and patients are isolating at home. We have reduced community transmission, so we appeal to the public to continue to comply with the social distancing measures so that we can suppress the figure. My apologies. An update. We have 183 patients in critical condition, or 173 patients in serious condition, and about the 48 deceased patients. The male patients on the 6th of March did a RAT test, which came back positive. He had stomachache for 2 days. On the 8th of March, he approached an A&ED with stomachache and constipation. He had an inflammation. He was resuscitated, and we helped him release the pus. That was a viral sepsis, which is not directly linked with COVID. And about the Queen Elizabeth Hospital situation, I think we can all see that the situation has been very serious in the past 2 months. Our frontline staff have been doing their best to help patients. Once again, we thank our frontline staff, not only the staff in QE. Medical staff from different clusters have been contributing a lot, and we also thank the public for cooperating with us. Next question, the lady in red. The gentleman in red. I'm Le Hei-yin from Orange News. Now about the reporting. The government said random confirmative tests or PCR tests would be performed on reported cases. So how many cases are confirmed, and have we found any false reporting? And by the end of March, we will have 20,000 additional beds from isolation facilities. The government is also identifying a new isolation facilities. Now, given the developments of the epidemic, how many beds will we need? And when can we put all the patients into isolation facilities rather than requiring them to stay at home? Now we have received reports that isolation. We are told that isolation orders would be issued after reporting on the internet. However, it was we are told that some patients received a no isolation order after reporting the cases. Does it mean that the online electronic form is no longer in operation? Thank you for your questions. On random testing, after launching the RAT registration platforms, members of the public can report their RAT positive results on their own. We have a mechanism to perform random tests among the reported cases. PCR tests would be performed on those cases. We want to make sure that the platform is being used appropriately by the public. And also, we want to see what the PCR results would be for those patients reported positive on RAT. If there is false reporting, there may be legal actions. I'm not in the position to tell you how many confirmative tests we are doing each day. So we hope members of the public can cooperate with us. If you have reported RAT positive on a platform, if you are being selected, you would receive a call, and then the contractor would call you and notify you that you need to save a sample for PCR test. The contractor would deliver a PCR test kit to your door for you to perform a test on your own. You should follow the instruction on the packet and perform the nose swab yourselves, and then leave it at the door, and the contractor would pick it up for test. If the PCR test comes back positive, or I believe that would be the majority of the cases, then you would receive a SMS. If we have any PCR negative tests, we would find out the reasons. For community isolation facilities, the government is working to ramp up our isolation facilities in capacity in Hong Kong. For all patients, especially patients who are just tested positive, we want to isolate them to avoid community spread. That is one of our major measures to cut the transmission chain. Every day we have some 30,000 cases each day to 40,000 cases each day. The trend may be a downward one. However, there will surely be tens of thousands of patients requiring isolation. We have a shortage of isolation spaces. We will select patients with high risk or with special needs to check into isolation facilities first. If the capacity is increased, or if the number of cases drops, then we hope we can quarantine. We can isolate every patient in our facilities. For patients with symptoms, with serious symptoms, they will be sent to hospitals. The last question was on the reporting platform and the electronic form. These are two different platforms. The RAT platform is for patients who have tested positive on RAT at home. They can register on the platform, they need to submit their personal data and their ID and the photo of their ID card and the test. If the registration is a success, then we would issue an isolation order to the patient and a quarantine order to the to the household contacts. We would require the telephone numbers and ID numbers of the household members. The electronic form platform has been set up earlier on for patients to report to us their positive results. No ID, no photos of ID card or the PCR tests are required. When they did the PCR test, their identities were already confirmed by the contractors. The laboratories have already reported these cases to us. The idea is to collect their personal data swiftly without making phone calls. So when these patients receive the SMS notifying them of their positive results, they would be given this e-form to submit the personal data and the data of their household contacts to us. Isolation orders and quarantine orders have been dealt with. Now we have increased manpower to deal with, to speed up dealing with these cases, and also with the platform which has just been launched. Patients will receive isolation orders swiftly. Sorry, the speaker is not coming through the mic. Starting today, previously we mailed it by post.
The lady on the left. I'm from TVB. A number of questions. First one. For the exhibition hall number 1, AWE is closed all along. It's not taking any patients. So what is the status with exhibition hall 1? Why is it closed? Now, Dr. Larry Lee of the Hospital Authority said before that exhibition hall would be reserved. So what do you mean by reserve? Has it been converted or not? Is it because you don't have enough manpower, so you're not operating that hall? Now, the HAWE, of course, is, the exhibition hall there is large, so it could take on many patients, so would it be opened? As for RAT, if people test positive and if they don't report the cases, would there be any penalty? Because how would you find out if people have not reported their positive results? For the Hospital Authority, we'll look at clinical needs of patients and arrange for confirmed patients to go into different types of treatment facilities. In recent days, we've seen a sudden surge in number of patients. So for those with the more serious condition, they will be sent to the AWE community treatment facilities. Among the patients still at the AWE treatment facilities, most of them are the elderly and they have certain mobility problems. And also they have probably different types of underlying condition. So we need relatively more healthcare workers to take care of these patients. That's why the Hospital Authority is now focusing its resources, manpower, on taking care of patients in exhibition halls 8 and 10. As for exhibition halls 9 and 11, we're also arranged for suitable patients to go there. So that's the current situation. On the question of reporting positive RAT results, now we have launched this online platform for registration. It's because we want the public to let us know if they test positive with RAT. There are several considerations here. Firstly, if members of the public show symptoms or they are the high-risk groups, then they should do the test as far as possible. Well, the RAT is a convenient and accurate way to find out if one is an infected person or not. And if one is infected, then reporting that online will let us know how many new cases there are each day. And also, second consideration is that if someone tests positive with RAT, he is actually a confirmed case, so he needs to inform the government so we could record that as a confirmed case. And then the person will have to be isolated at home and family members have to be quarantined at home. And also we have to arrange for the person to be sent to community isolation facility. So if you have an RIT positive result, please let us know as soon as possible. If you say test positive today, you should inform us latest by tomorrow. And then when we receive the information, of course, we'll handle the cases properly. Now, you say some may choose not to report the cases. Well, when it comes to law enforcement, as you would understand, the tests are not done by any health institutions or at any community testing centers. It's voluntary tests taken by members of the public on private premises. So it's not possible for the government to tell who's done the test and who has not. That's why we could only appeal to the public that given the current epidemic situation, if they need to do a test, please do the test. And if the test result is positive, please let us know at once, as soon as possible. And then we could take a series of measures to give help to the infected person and also to help the government to obtain the data on number of cases, and then we could formulate strategy accordingly. Well, earlier I mentioned that for patients in other exhibition halls, we've changed the types of patients there from the previous arrangement. Now we are talking about patients that have strong need for care, and that's why we have put the patients in 2 exhibition halls so we could focus manpower there. And that's why we are now putting more people in the 2 exhibition halls, and that's why exhibition hall 1 is now a reserve. I'm from cable TV. Now, some elderly residents told us the isolation order is in English only, is not in Chinese, so they can't read it. Would you consider giving them a Chinese version? That's the second question. There are HA staff members who've done quick tests. On the 27th of February, the test result was positive, and on that same night, the saliva specimen was left for PCR test. Again, the result was positive, and there's reporting on the relevant platform, but so far the person has not received any isolation order on other kids and so on, and family members too. So how come they have not received any notification? Is it because HA staff are treated differently? Now, QEH will become a designated hospital, so how many operations have been cancelled? What if some patient's condition deteriorate or even die in the course of transfer? How would these cases be handled, and which departments would be responsible? As for the cancelled surgeries, would they be rescheduled? On reporting positive RAT result on the online platform, people will receive the isolation order and other information. Now, we know the isolation order is in English only for the time being, and some people may not be able to read it. We will try to arrange both a Chinese and English version as soon as possible. Now, usually for people who receive isolation orders, they would have been in hospital or in isolation facilities, and then healthcare workers could explain the order to them. And now this is a new arrangement, and we see the need, so we will be making changes to make sure that the isolation order is in both English and Cantonese. Now, if people have just received the English version of the isolation order and they don't speak English, then I would just suggest that they take note of the date and our apology. Some people may not be able to read what's on the isolation order, but there is a date on the order. That means they should be isolated until a certain date. So that is actually day 0 is the day of collection of specimen. And then we're talking about 14 days. And then if someone have had 2 doses of vaccine, then on day 6 and day 7, they could do RAT tests. And if both test results are negative, then the isolation order would have would be deemed as completed. Your second question. someone has done RAT and then a PCR test, and but the person has not received any isolation order. Now, previously, RAT test results did not be reported to the Department of Health, so we wouldn't know about it. We will only have information about positive PCR result. And if the person did the test on the 27th, at the time we didn't have the platform yet, so we would only know about positive case when PCR test result became available. Now we have this online platform for reporting RAT positive results. So if you test positive with RAT, you need only report to us on the online platform. There is no need to do a PCR test as well. Sorry, speaker is not using microphone. Sorry, the speaker is not using microphone. Now, if there was a PCR positive result on the 27th of February, my guess is that when we receive the PCR test result, we would regard that case as a confirmed case. So that's already a confirmed case in our system. And if on the 9th of March, the person reported a positive RAT result, well, since the case is already in the system, then we would not send another isolation order. Now we know there could be positive cases as a result of PCR or RAT, and some of these people are still staying home. They are still not admitted to hospital, and there's a backlog of such cases, and so that's why we have not yet issued the isolation order. Now for people who are not yet admitted to hospital and who are not confirmed by health institutions, then we will deal with them later. Dr. Ho, please. About the Queen Elizabeth Hospital, QEH, and also the Kwong Wah Hospital in the same cluster. For the A&E departments for these two hospitals, they will only accept life-threatening cases or cases that require ambulance service. And then to facilitate this hospital to take in COVID patients who attend the A&E department. Now, for scheduled surgeries, we are now transferring patients in batches to other suitable hospitals in the 6 hospital clusters. They're helping to take in suitable patients, and these are cases with scheduled surgeries, and then surgeries will be arranged in these other clusters. Now, you mentioned transfer of patients to other hospitals. Well, that's a very important step in the process for us. So we'll only select patients whose conditions are suitable and whose condition allows them to be transferred. As I mentioned yesterday, let's say there are some in the pediatric ICU. These are critical cases, then they're not suitable for transfer and they will stay in the Queen Elizabeth Hospital. I think that's about the arrangement for transfer. Well, an English question on the back there, the lady in grey.
Thank you, doctors. I'm from Bloomberg News. My first question is for Dr. Au. Can you confirm whether Hong Kong has already seen a peak in COVID cases between the 2nd and 4th of March? My second question is for Dr. Ho. We're still seeing a very high number of deaths, counting over 100 backlog in deaths today. Can you explain why we're still seeing a lot of backlog and why these cases are popping up several weeks afterwards in the record? And the mainland expert Liang Wannian said that he thinks that the number of deaths are stabilizing. Can you confirm that this is what we're seeing within the public health system? Thank you.
For the first question on the epidemic situation, according to the figures on PCR positive cases, we have seen the peak around the 2nd to 4th of March, reaching over 50,000 cases per day. And after that, there is a decrease in the number of positive PCR cases to around 30,000 from 5th to 6th of March, and then further decreased to a level of about 25,000 to 30,000 per day in the past 4 days. So judging from the RT-PCR positive cases, we are seeing a gradual decreasing trend, and probably we have already reached the peak. And on the other hand, we have additional figure on RAT positive in the past few days, and there were around 10,000 or more cases per day tested positive by RT-PCR. There is no increasing trend, and the trend is quite stabilized. So we think that the number of cases in the past few days ranged from around 40,000, something like that, and there is a plateau without any further increase. So probably we have already reached the peak, but we still need to observe, and we advise the citizens and all the general public to remain vigilant, because the number of cases still remain at a quite high level, although it did not, the trend has stabilized with a plateau. And we hope that with further enhancement of the testing as well as the social distancing measures, we can further cut the transmission chain in the community, and we hope that there will be a decrease in the near future. But I remind that all the citizens should remain vigilant at this present day stage, and do not be too optimistic because of the high number of cases, which might lead to rebound or upsurge if they have relaxed in the prevention measures.
So as mentioned by Dr. Au, there have been over 50,000 new confirmed cases in last few weeks. So that's why a number of patients are waiting to be treated either in A&E, designated hospital, or inpatient services. At the moment, our medical staff are busy in taking care of the cases, and then we are trying hard to manual input of the data. So that's why there are some still catching up phenomenon observed, and we are trying hard to do that. And for the death toll, actually, we have tried to set up some designated hospital to increase the capacity to take care of the patients. And also we have enhanced the community support by providing some hotlines, designated clinic, as an aim to achieve the increased triage and stratify treatment. And we hope to decrease both the mortality and morbidity, and also decrease the infertility.
Next question, another English question. The lady in the front.
EMP. So other than the hospital in Chinese University, which private hospitals will be treating COVID patients? How many beds are there, and is there a timetable for these hospitals? How many patients in Feng Yu King hospitals will be transferred to other hospitals? As other public hospitals are also flooded with patients, how will HA make sure that they have enough space to take in other patients from QE and Feng Yu King, and they are capable of taking of the patients? And the last question is, as the media reported that an infected elderly home resident died of lack of care and food after waiting at the emergency department in a public hospital for 5 days, what's HA response? And how will HA prevent similar death in the future? Thank you.
For the private hospital, besides CU a medical center, we also have, sorry, let me check. We have St. Teresa Hospital, Baptist Hospital, and St. Paul's Hospital, and Precious Blood Hospital, and Glen Eagle Hospital, and Chuen Wan and Hong Kong Adventist Hospital. and also Yan'an Hospital. So at the moment, the total number of private hospital provide bed to HA is 263 beds, and we have 94 patients referred to private hospital for continuation of the care. And for the Phong Chiu King Hospital, and we will try to mobilize 260 beds in Phong Chiu King Hospital to take care of COVID positive patients. And some of the patients has already been transferred to the DK Duchess of Kent hospitals, and also Duchess of Kent Hospital. And overall, and we aim and target around 50% of the total HA hospital beds converted to COVID beds to take care of COVID confirmed patients. And with increasing of the capacity of hospital, we hope to shorten the waiting time for the admission of the confirmed patients to inpatients, and also shorten them or decrease the mortality of the total COVID cases.
下一題，後排中間。
Next question, the gentleman in brown. Good afternoon, Hong Kong 01. We have received requests for help. Some members of the public were tested positive, and then on the 6th and 7th day, they were tested negative. However, there was a RTD in force, and then after that, they were tested positive again, and then they had to count the isolation period from scratch. So what is the calculation method for these cases? When can they be deemed as having fulfilled the isolation order? And the second inquiry is about members of the public who are staying in makeshift hospital, and they have fever, and they complained of the lack of antipyretics and other medications. So for community isolation facilities, do we have sufficient medical staff to conduct checks on patients? If medication is needed, how can the patients ask for them? Now, hair salons are going to reopen. So what is our risk assessment for hair salons? Will it bring about infection risk with the reopening of hair salons? Is it possible that they will be asked to close again after the 14-day review period? Now, we haven't had haircuts for some time already, so will it cause inconvenience to the public? Now, about our isolation facilities. For patients tested positive on RAT or PCR, we count the sampling day as day 0. And then if you test negative on RAT on the 6th and 7th days, and if the patient has had 2 jabs, isolation period would be deemed as fulfilled, and the patient would be deemed as having recovered. It shows that the infection risk to the community is relatively low. However, if the patients have not been vaccinated or only 1 dose is received, then he will need to undergo isolation until the 14th day. And he can only leave home or leave the isolation facilities on a negative result. On RTD or restriction and testing declaration, it is different with patients at home. Usually, a lot of cases would be found in the same building. In the past few months, we have seen as much as 15% of the residents testing positive in the same building. We have seen an infection in such buildings. So we want to be prudent. Special arrangements would be put in place for the residents to go into isolation facilities to avoid causing additional risk to other residents. For RTD, patients tested positive on PCR would be arranged to go into isolation facilities. The calculation method is the same. The sampling day is day 0. For those with 2 jabs, on the 6th and 7th days, they would be given PCR test. If it is, or RAT test, if it is a negative, they would be allowed to go home. Second question about patients presenting with symptoms at makeshift hospitals. I would invite Dr. Ho to answer this question. Now, the HKSAR government is reviewing various social distancing measures every week and review whether premises should remain closed. Now, the situation is serious. The Departments of Health and the relevant departments would keep reviewing the situation and judge what premises would be allowed to reopen. We would consider the inconvenience caused to the public as well as the epidemic situation. For hair salons, back in February, we have seen outbreaks in hair salons. So there is a risk. When you are having a haircut, you would come into close contact with the staff members. So everyone has to wear a mask. And if you have symptoms, you are not allowed to go to a hair salon. And for high-risk groups, regular tests should be performed to avoid outbreaks.
On community isolation facilities, we have actually medical stations. So for people in these facilities, they would be given medical assistance. The hospital authority team is responsible for is working closely with the Security Bureau, which manages the Qingyi community isolation facilities. And when patients are admitted there, the hospital authority healthcare team would provide suitable support, for example, health information and so on. And if there's a need, healthcare workers would provide medical assistance. Next question, please. I'm from AM 730. First, about quarantine centers. The occupancy rate of 5 quarantine centers just 2.something% at noon today. Does it mean that you're not going to arrange for close contacts to be quarantined on a massive scale? And why are there so many rooms still not used? Would you consider turning these into isolation facilities instead, so you could make good use of the capacity available? Now, for some mobile testing stations, it says that they will allow anyone who wants to take tests to take tests, but then some have told us that they have to produce proof of negative test result before they could take the test, you know. And so, but if the principle is that you should allow anyone who wants to take the test to take the test, then what should be the criteria? And then for hospital authority, now we have Feng Yu King and another hospital. And what about another hospitals that you mentioned yesterday? When will they be converted into COVID hospital? How many beds are there? For RAT, you say you will be doing random checks. You say you're not at liberty to disclose the number of cases, but is it the case that for all the cases you have checked on random, that you have confirmed the positive results? Thank you. You have a number of questions. First, about the quarantine centers. When we did not have so many cases, we would do more detailed contact tracing work, and we arrange for close contacts to move into quarantine centers. That's the case for all close contacts, including family members. But now we don't have the enough capacity of quarantine centers to cope with so many close contacts now, especially family members. And that's why the government has launched the Stay Home Safe scheme. So for family members living with infected persons, usually the infected person would be sent to community isolation facilities, or there could be home isolation. As for family members, the current arrangement is mostly the Safe Home Safe scheme. So that's why that will be lesser need for quarantine facilities. In fact, the government would review the demands for quarantine facilities from time to time, but at the moment we have too many cases to handle. So we now focus on those who've been in contact with positive cases as close contacts. And for that infected person, because the person has positive, there's a risk of transmission, so we deal mostly with the infected persons, and we see there's a low occupancy rate for quarantine centers. We are aware of that, and so for quarantine centers, they will be converted into community isolation facilities step by step. That includes hotels, and this is something we keep working on and keep reviewing. For mobile specimen collection stations or community testing stations, now usually PCR tests are done for these stations. I've not heard that contractors have to have negative results before they could there has to be proof of negative test result before these people specimen will be collected from these people. Now, for people who need to do tests because they have compulsory testing notices and so on, they can go to these mobile stations before to get tested. There's no need for them to do their own RAT in advance. Of course, if members of the public have done their RAT and the result is positive, then there is no need to do a PCR test. On random checking, we've only just started yesterday, and from yesterday on, we have contractors going to the homes of those who've reported RAT positive to collect specimens from them. Now, we will be converting more hospitals into designated hospitals. Yesterday, there's mention of the Ratchanji Hospital and the Haven of Hope Hospital. We are making preparations now, and when we're ready, we would make the announcement. The lady over there, I'm from Ming Pao. A question first for the hospital authority. The Queen Elizabeth Hospital, well, there's triaging now at the Accident Emergency Department of QE. So how many patients have been transferred to other hospitals? And if you send these patients to other hospitals, would it add to the waiting time at these other hospitals? The second question is still about QEH. How many patients who are now receiving treatment in this hospital have to make new appointments? And for those who have not made new appointments, when will they receive notice? And how many patients have to be moved to other hospitals? And what sort of specialties are involved? Now, for stay home safe, if someone tests positive at home and is isolating at home, and if there is a restriction testing declaration order on the building, then do they still have to go downstairs for testing? Because we've heard cases that once a person tests positive, there's no need to do the PCR test because of RTD, but eventually the person was sent to Chengyi, so the arrangement is so chaotic. So can you explain whether someone needs to do another PCR if the person is already tested positive with RAT, and if they test positive with PCR, do they need to be sent to Chengyi regardless of their home isolation order? For the QEH, apart from acute cases or pregnant women, other patients will be sent to other hospitals. Now, we don't have the number at hand, but we would like to thank other hospitals again for their support. We're also grateful to patients for their understanding. there are patients going for a follow-up consultation at the outpatient clinic. Well, it's actually a separate building at the QE, and so people could still go there for follow-up consultation. But then if there is need, we will inform patients proactively about the arrangement. On restriction testing declaration arrangement, RTD. Well, these are major exercises involving a number of departments. If there is need to impose RTD on a particular building, in theory, all residents in the building have to be tested. But then the approach we are adopting is, if some persons known to be positive, there's no need for them to do the test again because they are confirmed cases, so there's no need to duplicate the test. For positive cases identified through RTD, usually it's on the second day when the results are available, and then we arrange for all these positive cases to be sent to community isolation facilities. Usually, for those who are sent to community isolation facilities, they are positive cases identified in the RTD operation. But of course, there could be some who have already become confirmed cases and are in home isolation in that building. Now, if they are recent cases, for example, 2 days before the RTD, some people tested positive. We will still arrange for these positive cases to go to community isolation facilities, even though they are not identified in the RTD. Now I'm from Ta Kung Pao. I have 3 questions. First one. There is a serious shortfall in isolation facilities. How do we make the most of these facilities? At AWE, how many beds are there? How many people are staying there? The second question. Now you say you are going to invite mainland healthcare workers to work at AWE. How many are working there? And then has the hospital authority done an assessment which sort of which types of workers do you need the most? And then some are reporting RAT positive result to the government, and then they go and take a PCR test, and then it's 18 days, they still have not received the PCR test result. So they could only therefore register at the PCR platform but not the RAT platform. Is it because that there's some samples are actually not tested, and so people never receive the result? And what if people still do not receive the PCR test result, and then they don't get any support, and they're not able to call get through to the hotline and so on? So what should they do? I'll reply in Cantonese. First, about community isolation facilities. The government is trying to build more community isolation facilities, so confirmed cases could be isolated from the community as soon as possible and reduce the risk of transmission in the community. Now, the Security Bureau is responsible for the assignment of isolation facilities centrally. If the Department of Health receives positive test results, we'll look at the date of specimen collection. Now, if we're talking about recent positive cases, either by PCR or RAT, we will pass on the information of these cases to the Security Bureau at the first instance, so that these people could be arranged to go to community isolation facilities at the first instance. If people report their cases on the online platform, and there are factors that that would give them priority, for example, they live in crowded living condition, or they have family members who are in the high-risk groups, and for these people, they will have priority to go to community isolation facilities. And I understand the Fire Services Department colleagues would send SMS to these people to tell them they need to go to community isolation facilities. Now, so if you receive SMS from the FSD asking them to go to community isolation facilities, please respond as soon as possible. So arrangement could be made quickly. The government will make the most of existing isolation facilities and will arrange for those appropriate cases to be sent to these facilities. Can you repeat your last question? We know that now some may have tested positive our AT, and then they take another PCR test, but they've been waiting for 18 days for PCR test result, and they could only register the case on the PCR platform, not the RAT platform. So is it possible that some of the samples are not tested, and so people never receive the test result? And if people do not receive the PCR test result, or even if they register, they never get support, they can't call through to the line, then what can they do? And people usually, how many days do people have to wait usually for PCR test result? Now, people have done a PCR test either at the community testing center or at the laboratory of a healthcare institution. Then if the case is positive, then it will be reported, and then the person will be confirmed case, and we'll approach the person. Usually, now we ask people to give us the information on the online platform, and then we will issue an isolation order as soon as possible. Now, people could receive the isolation order through an electronic means. And if, say, someone tests positive without PCR test, then they could go by the existing arrangement to do RAT on day 6 and 7. Now, because this is already a confirmed case, so there's no need to report the result again on the online platform. But on day 6 and 7, if the test result remains positive, then they have to do 2 tests on 2 consecutive days, and if they get 2 consecutive negative results, then they could go back to normal way of life.
The hospital authority understands that the Hong Kong SAR government has made a request with the central government for deployment of mainland experts to support us. The HA will fully cooperate with the arrangement with the help of the mainland delegation. We believe that it will effectively alleviate the burden of our public hospitals, and we can achieve the goal of reducing severe and death cases. The gentleman over there. Good afternoon. Point News. Feng Pui Yin. Or Dot News. Yesterday, we received an emergency alert on our phones. We are told by some readers that some mobile phones models cannot receive such alerts. So will it happen again that whenever there is an emergency alert, they will not be able to receive it? Today, at the press conference, the chief executive said we would strive to achieve early isolation. However, we are told that some people have 3 family members fallen ill. They have been calling government departments, but no support was given to them. So they are stranded at home with no support. So what's the best way to deal with the situation? Last question. Now, there are idle facilities or capacity in the AWE. What is the occupancy rate at the AWE? On your first question, issuance of emergency alerts, some mobile phone brands cannot receive it. It is a technical issue. I'm not in a position to answer the question. You may have to ask the department. At present, the government is utilizing isolation facilities to take in suitable patients. For patients tested positive, the CHP would send the data over to the Security Bureau for them to arrange admission for these patients. The Fire Services Department has set up a hotline and a WhatsApp number. If you have not received a SMS to notify you of admission to isolation facilities, I suggest you calling the hotline to report your case. Once the government has such information of the patients, they would call the patients up as soon as possible, especially for those in priority groups. If you are experiencing serious symptoms, you should not wait and you should seek medical assistance. For the AWE, like we have mentioned, we are mostly accepting elderly people who are bedridden with chronic diseases into AWE. That's why we have to focus our resources to provide priority care for them. Last question.
I have a question about the RAT numbers reported. I would like to ask if the 7,000 reported today were SMS validated, and on the first day when the platform was launched, there were 14,000 positive RAT results that were not SMS confirmed. And so I'd like to ask if these 14,000 cases were discarded. Secondly, on the mainland Chinese medics, is there an expectation of when they will arrive in Hong Kong and how many, and if they will help out with hospital and elderly care? Third question is how many HA staff, medical and non-medical, are diagnosed with COVID today? And the next question is which department currently assigns COVID patients to every community isolation facilities, and how are they assigned? What are the criteria to decide who goes to a hotel and who goes to a container-style facility? Is it based on their medical conditions or is it random? Thank you.
I will reply the question on our AT platform and also the assignment of community isolation facilities, and maybe Dr. Ho will respond to the questions on medical personnel. For the first question on our AT platform, there are two processes. First of all, if a citizen they tested positive by our AT, they need to go to our website and then submit their information. Basic information, including their personal particulars, as well as their occupation, address, and also information on their household members. And if they successfully provide all the required information, then they are successful in submitting the information to us, and they will receive an SMS instructing them to go to another website to upload their Hong Kong identity card as well as the photo of the positive RAT test, so as to complete the verification process as well as receiving the isolation order. So yesterday we have issued an isolation order to 7,012 cases. So these 7,012 cases are all submitted the information as well as they responded to the SMS message and submitted their identity and successfully obtained the isolation order. So they are regarded as confirmed cases. In the first day, I have reported there were about 14,000 notifications to us. These 14,000 cases refer to the number of submissions through the platform. That is the number of persons who have submitted information and received the SMS. And on the first day, because there were only 6 hours from 6 p.m. to midnight, so among these 14,000 submissions, only 2,018 cases had successfully submitted their identity card and also the photo of the positive test to us, and we have verified such cases. But for the remaining cases, we received the upload of the identity card and the photo on the next day. So this case, the remaining cases, the major majority has successfully completed the verification process and were included in the number of cases reported on the 8th of March. For the questions on the allocation of community isolation facilities, the Security Bureau, in liaison with the Fire Services Department, is responsible for allocating confirmed cases to various isolation facilities. The Center for Health Protection, upon receiving a report of positive cases, we will provide the information of the cases to the Security Bureau, who have a centralized team to coordinate the process of allocation based on the availability of various community isolation facilities. And they will accord priority to those with some special circumstances which warrants early admission to community isolation facilities. For example, those living in crowded environments or with household members who are at high risk of infection, for example, immunocompromised persons. So these cases will have priority to be admitted to CIF. But in general, all patients who can take care of themselves independently, aged 16 to 17 years, without medical needs, they can be admitted to community isolation facilities. And if there are enough capacity, the government will try to arrange as many as possible cases to the CIF.
So up to now, we have 12,554 staff have been confirmed COVID positive, and up to now, 4,455 staff have returned to work. And I'm sorry that I don't have today's data. And also, the hospital authority is glad that Hong Kong SAR government have appealed to China to send the medical team to Hong Kong to support the COVID management. And HA will continue to collaborate with the China team, and hope this medical team sent can improve or alleviate the medical manpower stretch at the moment, and then can achieve the aim of decrease the mortality, morbidity, and also infertility rate, and achieve manage the COVID situation.
記者會結束啦，多謝大家。
That's the end of the press conference. Thank you.